Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
You might not have to look any further than your own family to learn whether you're at risk for certain medical conditions, such as heart disease, stroke, or high blood pressure. Today, we are going to share how you can build a family medical history and how this important document can be a roadmap to your better health. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Beth Brown, your host. Stay tuned. We'll be right back. Welcome back to Healthy Living for Life. Our first guest this morning is Dr. Justin Perry, who specializes in family medicine at St. Peter's Health. Welcome. Thanks for being here this morning.
Thanks for having me here today.
Can you just start out, Dr. Perry, by talking about what exactly a family medical history is?
Family medical history is a record of health information about a patient or a person and their relatives, their blood relatives. Usually includes 3 generations, so it would include your siblings, your parents, your grandparents, aunts and uncles. Okay, and what does a family history do to help a person? Why is it good to have one in place? It's a good tool to use to, help you determine maybe what health risks you have in your family. There's a lot of diseases that are maybe hereditary, and by looking at your family history, you might be able to determine is there certain disease states that you maybe need to worry about in your life. And it also is a good tool to help motivate you, maybe seeing these things or these diseases in your life that you may be more motivated, maybe make different lifestyle choices.
Okay, great. So is it important then to share that sort of a document with your doctors?
Oh, definitely. Giving this information to your primary care physician can be very valuable in that it can help your physician determine health screenings, because there's sometimes with different diseases that might move forward health screenings for like certain cancers. And it changes your risk by knowing that the physician will be able to look at you and say, okay, this patient maybe has a greater risk for this disease, so maybe we need to monitor it earlier and more often.
Okay, and you sort of alluded to this a little bit already, but does having a family medical history in place often spur people to take those steps for preventive measures, maybe to lower their risks for some of those genetic diseases?
And I think definitely. Having that knowledge that certain diseases are prevalent in your family can definitely motivate someone to try to live a more healthy lifestyle, or maybe even to follow up with a physician more often. And so I think it can be definitely a valuable tool to an individual.
Good. Do you think there's a certain age someone should put a family medical history in place?
I don't think there's a specific age. I think doing it sooner than later could be valuable. First of all, that allows you, if you do it earlier, to make changes in your lifestyles earlier on that could benefit your health moving forward. But also, by doing it earlier on, maybe allows you more time to gather that information.
Okay, that makes sense. And how about making one for your children? Is it a good idea to put together a family history for your kids?
Definitely. That'll save them a lot of the work of trying to gather that information. I feel like even in my family, like maybe not knowing what the health issues are in my grandparents, where if my parents are sharing that with me, then that'll be easier for me to access that knowledge.
Great. So just to be clear about this though, just because someone has a family history of certain medical conditions or diseases, that doesn't necessarily mean you're going to get that disease, right?
Yeah, no, not at all. Like if it's just a tool to show possible risks you have. Just because your family members have had disease, say a bunch of your members of your family have had high blood pressure or heart attacks, doesn't mean you're going to have a heart attack or have high blood pressure, but it does show that you probably have an increased risk of that. And so by knowing that risk, it'll allow you and your physician to create a plan or maybe make recommendations for lifestyle changes that can reduce that risk.
Okay, are there certain medical conditions or health conditions that maybe are more likely to be passed on to your children or genetically be passed on? Can you talk about some of those that
definitely,
might be more common?
Some of the cancers.
Okay.
Breast cancer, ovarian cancer, colon cancer, even like prostate cancer are some of the cancers that if they are real prevalent in your family, that might show that you have an increased risk of developing those, as well as chronic conditions such as high cholesterol, high blood pressure, heart attacks, diabetes, strokes.
Okay, so if a person knows that someone in their family has had one of these conditions, what steps can they take, or should they be more concerned about their own health if they know that some of those conditions are in their history?
I think they definitely need to share that history with their provider so that the proper screening tests are done to ensure that they maybe aren't developing those diseases. But it's also, I think, carrying that knowledge, it's important, for the patient or the person to recognize that and say, like, hey, I have this propensity in my family for certain diseases, and so that I should maybe make lifestyle changes.
So you've talked about those lifestyle changes a little bit, and obviously the screenings with your doctor would be helpful, but what are some of those lifestyle changes maybe that people could do if they, for example, know that there's heart problems in their family or diabetes?
Definitely some of the lifestyle changes that people could look at doing is, like living a healthier life in the sense of exercise and diet. Those are two major ones. And a lot of people have diabetes and high blood pressure, and those are things that can be controlled with lifestyle changes rather than just necessarily medications. And so by recognizing that, they can maybe earlier on in their life make those lifestyle choices.
Okay, great. So that is some great information. We're going to go ahead and take a break, but stay tuned to learn how you can create a family history and to learn about genetics, genetic testing, and how it ties to your family history. We'll be right back after these messages. There's a lot more to learn about. Don't go away. Welcome back to Healthy Living for Life. We are now going to talk about genetic testing and how a family medical history helps doctors with that testing. Joining us now are Jaclyn Haven, who is a certified genetic counselor, and Corbin Schwanke, who is a genetics lab supervisor. Both Jaclyn and Corbin work in the medical genetics department at Shodair Children's Hospital. And thanks to you both for being here with us this morning. Can you just start out by talking about how can genetics fit into providing a better care plan for a patient?
So genetics is really integral in all areas of medicine, and more so all the time. And so we found that we're really able to integrate well with providers from all different areas and with patients of all different ages. So.
Okay, great. And so how do doctors and other healthcare providers use genetic testing to either diagnose or pinpoint diseases?
So genetic testing looks for abnormalities in a person's DNA. And if those abnormalities occur in a gene that correlates with a patient's condition, doctors can use that information to either direct treatment for the patient or help diagnose other family members. And the family medical history really applies there because these genetic conditions are very variable. So people like Jaclyn talk to patients about what's going on in themselves and in their families, and then we can use the genetic testing results to help diagnose their conditions.
Why would a patient be sent to your genetics clinic?
Really for a number of reasons. So we see patients from all ages, from before birth to end of life, and for all different indications. So we see patients who maybe have a personal history of disease, maybe have a family history of disease. Commonly it's people who have a family history of cancer or maybe a diagnosis of cancer themselves. And we work with them to see if we can determine a genetic susceptibility to disease, and if we can find it, kind of what we can do differently to help them be healthier.
Okay, great. So can you build on that a little bit about how genetics then can help that patient?
Yes, so finding a genetic susceptibility to disease really alters medical management significantly. And so, for example, patients who have a susceptibility to breast cancer, because they have a genetic mutation, qualify for increased screenings like breast MRIs. They might qualify for medications. We would discuss surgical options. And so all of those things are possible then with that diagnosis. And then also, importantly, we know that family members have up to a 50% risk of also being affected, and we can offer that testing to those family members as well.
Okay, so on that same vein, if someone knows that they are susceptible to a disease, Can they bring their children in at a young age to get tested for some of those that they know is in their family history?
Sometimes. So it really depends on the disease itself. So for adult onset conditions like cancer or certain neurological conditions that don't present until adulthood, we do not recommend testing children or people under age 18 because we truly want people to make their own decision to pursue genetic testing or not. It's a very individual decision. And so if it is an adult onset condition, we do recommend waiting until they are an adult to pursue testing. If it's a condition that would affect a child and might have medical management consequences in childhood, we would certainly test children.
Okay. How accurate is genetic testing?
That's kind of a complicated question. Our ability to detect changes in DNA is highly accurate, up to 100% accurate. Determining what those changes actually mean in the context of a disease is much more complicated. Because when you consider that humans have roughly 20,000 total genes, one change in one gene is not a black and white, you will have this disorder and it will look like this. There are a lot of interactions between genes, and everyone has variation in their genes, even siblings. So even siblings with the same mutation in a gene might have very different disease presentations. And again, this is where our family history really plays into the diagnosis and the management of these patients.
What is a genetics counselor?
So genetic counselors are healthcare providers who work in a variety of settings. We all have advanced training in both human genetics and counseling. And for myself as a clinical genetic counselor, we really work within a healthcare team. So for myself personally, I work with a medical geneticist who's a MD, other genetic counselors, a psychologist, a nutritionist, the lab, very closely, and together we try to find answers for families. And the genetic counselor is often the person on the team who's working most closely with the family.
Okay. If someone wants to go in for those sort of services or for genetic testing, does health insurance cover those kind of services?
Yes, for the most part, genetic testing is covered depending on the condition, but just like any other medical situation, you always want to check beforehand to make sure your insurance company is going to cover the services, and your healthcare provider can help with that information as well.
Great. Is there financial assistance for those folks where maybe health insurance won't cover those costs?
Yes, several options. So state, federal funding is available. Funding through our hospital is available. And we really work with the family to find different funding sources. And so we never want patients or families to not pursue genetics due to cost. We can almost always find a resource for them to pursue testing.
Great. Who orders genetic testing? Is that something a primary care physician does, or does a patient make that decision?
Primary care providers can certainly order genetic testing, but we always encourage them to consult with us beforehand because these are complex disorders, and oftentimes the test that a primary care provider may think is appropriate may not actually be the right way to go from the outset. So we always encourage and we welcome collaboration with the primary care providers.
Okay, we need to take a break here in just a few seconds, but really quick, can you just tell us about your program and how someone could be referred to you?
Yes, so we're a clinical and lab program. Our clinical team does clinics throughout the state of Montana. We also connect with patients via telemedicine from anywhere in the state of Montana. So we even connect from patients' homes. And then a referral could come from the provider or from the patient themselves. And all of that information is available on our website.
Awesome. Thank you so much, Jaclyn Corbin, for being here this morning. We do need to take a break, but really great information. Stay tuned. Up next, we're going to learn how to create a family medical history. We'll be right back after these messages. Stay with us. Welcome back to Healthy Living for Life. Dr. Perry is back and is going to talk about how to create a family medical history. Thanks for coming back, Dr. Perry.
Thanks again.
So when you are approaching your family, What's a good way to do that, to bring up the whole topic of creating a family medical history?
I think first we're just finding a good opportunity, maybe when a bunch of families gathered so different minds can maybe share and help make it easier to recall maybe the disorders people have dealt with. So maybe like at a big family gathering, bring it up. But it's also important to be sensitive, because a lot of people, these health issues that they maybe have dealt with are really private, even they may not want to share with their own family members.
Sure.
And so just being really sensitive to your family members when you're asking about this. And I think it'd be important to explain why you're asking. Not that you're just probing and trying to find out what's going on in their life, but really that you're curious about creating this medical history for your family, so that, explain to them that, hey, I'm doing this so that I can prevent risks in my own life. And I think if you share the reason you're doing, they might be more open to sharing why or what the health risks that they've had in their life.
That's great. And what kind of things should you learn? What do you need to gather to put into that family medical history?
I mean, it's important to find out, like we've mentioned before, 3 generations. So you want to gather information from grandparents, aunts, uncles, siblings, parents. But it's also important from them to find out what diseases any of them had, to find out the ages when they developed the different diseases, talk to them about lifestyles, because some of these diseases maybe aren't so much genetic, but maybe just lifestyle-wise is the reason they had this disease. So to be able to determine, certain family members live a very unhealthy life, maybe that's why they developed this disease. Maybe other medical conditions they might have had. It's also important, like alcohol, drugs, just trying to get some other factors that might contribute to disease and let that be known to your family.
So that's a lot of information. How do you go about organizing all of that?
I think you can organize it any way that you find that you can organize. Some way that you're able to keep track of it. Either by family member or by generation. There's templates you can look at online that can also help you organize them.
Okay, and you mentioned too the being sensitive part. So what if family members are a little bit reluctant to share that information, or what if they just don't know some of those details? What do you do then?
I mean, if they don't know the details, but they're willing to share, and they're still alive, you could definitely ask those family members, if they'd be willing to get their medical records. If they're already deceased, and you could try to review obituaries. It's probably going to be difficult to access old medical records on someone that's deceased, but if that's a possibility, looking into that to see if a grandparent, what diseases they had. Those would be some of the main ways to do that. But I think it's important just to be very sensitive. Like if the family member does not want to share, maybe by explaining why it's important to you, that they'll be more open.
Okay. What about those folks who are adopted? It seems like that might be tougher. What's your advice for those people who are interested in learning about their family medical history?
People that are adopted, they need to reach out to their adoptive parents to see if the adoptive parents know anything about their biological parents. Okay. If they don't know anything about the biological parents, they could try to reach out to the adoptive agencies to see if they can then find out who their biological parents were. This may be difficult to do. You can also, if you cannot gather information, you have no idea what your family history is because of being adopted, you can at least now start from day one now and create a family history about you moving forward for your future generations.
Yeah, that's great. So I've heard the term family medical tree. Is that the same thing as a family medical history, or are those different?
It's the same thing. It's just a different format. Basically, a family medical tree is just more of a tree format, like a graph, like how you organize the data and the information. Okay. And then obviously, if you're gathering all of this health information about your family, that's sensitive information that if they were even reluctant giving it to you, you want to protect that privacy. So how do you go about making sure that that information is secure? Definitely keep it just in a safe place wherever you keep your files, and don't share this information with other people. If your family has shared this with you, you shouldn't be sharing it with friends or other people, maybe not even other relatives unless you've really gotten the permission to share it with them, but definitely just keep it in a safe place. It's important too, once you've had that information, and if you do have a primary care, to get your past medical family history on your records updated. Because once that's updated in your medical chart, then now that information's in a secure spot that won't get lost.
Okay. So if someone is looking at their family medical history and they're seeing trends, maybe there are multiple people in the family with the same sort of conditions, and it's alarming for them, what should they do?
They should definitely share it with their primary care physician or any of their physicians. This will allow the physician to realize, to recognize, like, is this a trend that is hereditary that we need to worry about and do earlier screening? For instance, people that have colon cancer in their family, colon cancer screening is typically at age 50, but if you have a family history of people with colon cancer in their early 50s or earlier, we'll actually move the colon cancer screening recommendations to 10 years prior to when their family member had colon cancer. So say if your father had colon cancer at age 51, we might start screening you at age 41 instead of waiting until age 50.
Okay, and so that's the main thing, is just talking with your doctor about some of those trends.
Yeah, if you're recognizing a trend, it's very important to share that, because otherwise your physician might not know to test for some additional, or do additional tests or do additional screening. But had they known about that history, they might definitely pursue additional tests.
Okay, and it sounds like too that this would take a lot of time for somebody to put together. Do you have some advice about the time it takes?
I mean, it could take a lot of time, so I just recommend starting it earlier and gathering this information. It might take years, before family members are open about sharing all this information. So I definitely just start earlier so that you have the time to gather everything you need.
Perfect. Thank you so much, Dr. Perry, for being here, and I'd like to thank all of my guests for being on today's show. Until next week, we hope you stay fit, stay well, and stay healthy for life with Healthy Living for Life. Thanks for joining us, and we'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.